present now. And when the crisis goes away is when he's present. He's even present even now. And the Bible tells us how we should not be anxious. Yeah, don't be anxious. And there's a very good example in Luke chapter 12 and also Matthew 6. Some of the things that I would probably suggest for pastors and spiritual leaders who are watching is to consider speaking to the members in a very deliberate manner. We acknowledge that they are going through anxiety. So even as we preach, may the Lord lead us to scriptures that address the issues of anxiety and fear specifically. People are not sure about tomorrow. So let's actually assure them that God knows about their tomorrow. We must indeed stand upon the rock that is immovable. Yeah, that we must hide under Christ, because it is Christ only who can safeguard us from all these things.
Well, that is very touching, and I'm certain that with those Bible verses, you're going to grow spiritually at this particular time and also be healthy mentally. And indeed, as we continue fighting this pandemic, our mental health is very crucial. Well, my next guest is a very familiar face to many of us. He is an actor and a journalist. Eddie Kimani is going to give us the media side of this as far as COVID-19 and mental health is concerned.
There could be an underlying problem that we are not feeling the impact yet, and that is how we are being affected in terms of our well-being and our mental health. And maybe it'll just come up, because this isolation, of course, is disconnecting us from knowing what's happening with our friends, our families. Everybody's keeping in and following the rules, which is a good thing. Now, there are a couple of pointers that I would want to emphasize on for us and for you individually, if you want to ensure that you stay sane and you're taking care and managing your mental health. I would encourage taking a break from the news. What I mean is, we are right now very easily tempted to constantly check our phones, constantly check what is out there in the social media, and unfortunately, we have the social media platform, which is where we are depending a lot for information. But sometimes this information cannot be correct all the time if you're not using the right sources. So I would encourage just to try and limit how much you're consuming in terms of social media news that you're getting out there, but you only rely on the actual sources. Like I would encourage people to follow these updates by the government, courtesy of the CS Mutahi Kagwe. I would encourage people to use websites like the WHO website, the World Health Organization website. They've got credible sources of information if you'd like to know what's happening outside the world. So basically, using credible sources and links to access information, but then again, also trying to limit it, because it can also affect your mental, in terms of seeing so much story, so much gory pictures that can really throw you off. Another point would be to try and keep a schedule, how you do your activities during the day. It's good to have that consistency, especially if you're working and you're used to a certain routine. Now you're at home, you need to create routines that are meaningful, routines that help you and that's when now you include things like the exercises, when you open your laptop or your computer to work, when do you sit down and rest, when do you take a nap, when do you sit with the kids and play with them. So I would like to encourage people to try and create buddy groups, of course virtually, so that you can help to keep in touch with each other. Now we are fortunate we have social media platforms that can help us form groups, and you can use it to keep in touch with each other. Every morning you wake up, you could even do a roll call. Out of your 5 or 10 friends, you just check each other. Are you okay? You're fine? That would help to, just keep you in touch with the people around you. And lastly, I would encourage everybody to be kind to themselves. Be kind to yourself. Sometimes you feel as if you don't feel like doing something. It is okay. Don't do it. Sometimes it's good just to sit and just be. But be kind to yourself. Don't beat yourself up because of what is going on.
And what do you think the government can put in place after this pandemic to now deal with these mental health issues, either counseling or such things?
I've noted they already have measures in place in regards to, they're not just waiting for it, excuse me, for it to end so that they can react to it. I've already seen some documents that are being shared all over about how to deal with your mental health now as we experience this pandemic. So they're already doing it. It will be prudent, of course, at the end of it all, to have responses and units that can respond to the need for people to get mental health checkups.
Well, avoid any misleading information or news about COVID-19. Stick to verified news sources and website. All this for great mental health. We'll be taking a very short break from Health Nuggets. Don't go too far, because when we come back, we'll be talking to a mental health specialist. Your health matters. Welcome back, and thank you very much for keeping it Health Nuggets. So COVID-19 is a public health emergency, a disease that has affected people globally. And it's clear that with this pandemic, we are not only fighting the virus, but we are also managing stress, anxiety, panic, fear, stigma, and discrimination. And we can all agree that these are part that hasn't been touched a lot by many, because many of us are focusing too much on the physical. But we can all agree that the information and the news that we are hearing about COVID-19 is getting deep into our minds. From the first part of the interview, we've heard from the media perspective, we've heard from a mental health champion, and we've also heard the church perspective. We are at Basic Needs Kenya, and we're going to analyze how we can take care of our mental health as far as COVID-19 is concerned. And to help us with this analysis, I'm being joined by Judy Kariuki, a project officer for mental health and well-being, Basic Needs, Basic Rights Kenya. Thank you very much, Judy, for joining us on show today.
Thank you for having me.
Now, to start with, we'll just let our audience understand the importance of mental health and COVID-19.
Okay, I would actually like to start with mental health. So when we talk about mental health, many people do not understand that it is about everything that we do. It is our mental health that helps us to actually do everything that we do, be able to wake up in the morning, actually even make our breakfast, take care of us, or rather prepare ourselves, go to work, be productive, even maintain relationships with other people. When we take care of our mental health, everything goes on very well. We are able to be productive, and we're able to maintain the relationships with others. But when our mental health is not very good, if we do not take care of it, then we will have problems with, from the moment we wake up in the morning to, and we are not going to be very productive in our daily lives.
And how is it connected to COVID-19?
It is connected to COVID-19 because now COVID-19 has come with a lot of uncertainties. Our normal routines have been distracted. Waking up in the morning and going to work is not as usual. Business is not as usual. So in one way or the other, our productivity may be distracted, and all the uncertainties that it has come with. We do not know what is going to, as in, we do not know if we are going to be locked up. We do not know who is going to end up having COVID-19 and dying, and who is going to survive. It has come with a lot of uncertainties, and that is affecting our mental health. If we do not take care of our mental health now, we may continue having problems way even after the COVID-19 has already passed.
And if you have any questions about our topic of discussion today, just feel free and make it interactive on our social media handles as displayed down below on your screen. And Judy, there's a lot of fear and panic, anxiety as far as COVID-19 is concerned. As an expert or as a specialist, would you say it's okay to fear, and what are maybe some of the remedies that we can do to become either less fearful or eradicate panic?
Okay, so fear is generally a stress response that our brain make. So when something happens, when we are confronted with something, our brain either takes action, or we have thoughts, or we change our behavior. So in this case, we have had a lot of fear because their death is actually involved, and loss of loved ones, loss of jobs, and loss of even the freedom of movement, and so many other different freedoms that we are not having at the moment. So we definitely be afraid, but we like to think of fear as what has it helped us to do? First of all, we have stopped, like the country is locked down, rather from people flying in and out. That one stops the spread. So and then we know we need to keep a social distance so that we cannot infect each other. We also understand that we need to clean our hands. If we did not have fear, we would continue doing things that may increase the chances of us getting the COVID-19. But because we are afraid, in one way or the other, the fear has helped us. Fear is supposed to make us adapt, but not make us, it's supposed to make us adapt and change our behavior in an appropriate way. So generally, there are some different responses that people have. If we keep thinking that COVID-19 is going to finish all of us, we are not going to cope well. But if we keep thinking positively, like there are some things that you can be able to do to stop it from spreading, to stop it from having such effects on us, then in that way, probably we can be able to have fear on our side, help us to cope, to be able to cope with what is happening. And it is very important. Sometimes fear also is spread by the wrong information. So it is important that every time something that has come up, it is full of uncertainties, and there is a lot of information out there that people are being they're getting information out there about how it is affecting people, what we can do. I think the best thing for us to do, for us to avoid mental distress, mental health problems probably later, it is to take care, to have the right information, and not just have the right information, but also use it so that we will be in a safer position. Yeah.
So you'll say avoiding fake news, either consuming or spreading
as well. Yes, and also looking for the correct information. Yeah.
The correct side to get this information.
Yeah.
Okay. And now parenting and children. In Kenya, children are at home right now, and I'm sure even all over the world, the institutions have been closed, schools have been closed, and these children are seeing what's happening, because children nowadays are very sharp to pick what's happening and what's not happening. So how do we protect these children as parents to ensure that they are informed, but again sieve whatever information that they are consuming?
Okay, it is actually very true that things have changed. Children are at home, the parents are at home, everybody is at home, probably around the same place. And children, they very much pick what their parents are doing. So if the parent should be the first person to be very on top of things about this COVID-19, understand it, so that you'll be able to explain to the child in a way the child can be able to understand. So it still boils back to getting the right information, and also eliminating the fear. If the parents, they have the right information, they are going to tell the children the right information. And also in case there is wrong information, just find a way of dealing with it at the home level. The parent might probably tell the children, oh, people are, if the wrong information, like, oh, people are really dying with this COVID-19, it's good. Yes, there some people have died, but look at the people who have recovered. So it is a battle that we can be able to fight and win. Just talk to the children in a way that they can be able to understand, and also engage them in different like activities. Have a normal routine if they're supposed to be, rather, if they need to learn new things or to continue with what they were doing in school, set apart some time for that, so that at least they wake up in the morning, have a routine. Then they can, you can even set a family time for, let's see what is happening with this COVID-19, and then you curb the myths and misconceptions and also find a way forward, and help the children understand that it is a good thing, first of all, to be with your family. It is not a bad thing to have the family around for a long time. And then even the parents can take the time to understand their children, and the children to understand their own parents.
And this will help both the parents mentally and the children as well.
Exactly. This will help them bond and have good mental health in their home.
And there are individuals that have had mental issues prior, and there are those that are facing the mental challenges currently as we speak. As far as COVID-19 is concerned, of course, there are news all over, and at some point you can't restrict yourself from seeing whatever is happening. So how do we ensure that these individuals do not go back to where they were, or those ones that are being affected, how do we ensure that it doesn't worsen even as COVID-19 ends, or as we are in the current situation?
Okay, I will say people with a lived experience of a mental health problem, some of them may find it a bit difficult, especially people with anxiety. So there is this fear that something, probably I'm the next one to be affected, anxiety. So that one will be, there will be a lot of that, probably now and even much later. So again, it is important that they understand the facts about COVID-19 and how it is understand even how it is affecting their mental health, and also try and look at the positive side, how many people are getting better, and also understand that there are measures that I can be able to take to avoid getting this COVID-19. It's not like it's a hopeless situation. It's actually very hopeful. We have more recoveries than the deaths. We have measures that we can be able to take to stop this from happening. That way, when people understand the facts about COVID-19, it is very, they will be able to, it will be easy for them to probably lessen the anxiety now and even later. Yeah. Okay.
So it's all about getting the right information and knowing what to consume and what not to.
Exactly. And also even good information if it is possible to try and just set, if I will be watching news only so that I'll know what is happening, that is good. Instead of every time your phone is talking about COVID-19, when you go to Facebook, when you go to Twitter, everywhere you go, and probably if your TV is on, the only thing you are hearing is about how COVID-19 is affecting this and that country. That one is not helpful. It is better to have at least one designated time where, instead of consuming so much information about the same thing, just have other things that are going on in your life, and then have that particular time when you'll be updating yourself on what is happening, and even the new measures that you need to take to avoid the problem from happening. That way, we will not have very many issues of people relapsing with mental health problems, and also even later, we will have actually learned how we can be able to cope with difficult situations. I think it is an opportunity for us even to learn, for everyone to learn how we can cope with difficult times.
And there are these special groups. We have the elderly, we have people that have interacted with the COVID-19 patients, we have those with chronic diseases. I'm sure if one of us was in that situation, of course they'll be having that fear, that anxiety, and that panic. How should they be taken care of, and how should they be fed information?
Okay, the elderly, as we have seen actually with everything that is happening, they are more prone, they are more vulnerable to COVID-19. The moderates are with the older people, but that is not to say that they are not recovering. Yeah, there are very many others who are recovering. So it is important also, first of all, to have a very positive view of everything. It is very good that we know that the older are vulnerable. That is a win, because that way we can be able to take care of them. Probably if it means to stop visiting them because we may be carrying the virus to them, we can take care of them in that we don't visit them. But not visiting them does not mean that we don't need to talk to them. Talk to them, find out how they are going on. It is also important that, again, we give them the right information. Old people understand. Children understand. Everybody understands that. So it is good to give them the right information in a way that they can be able to consume. Of course, not in a it's the old people who are dying more, no. But it is good that you take care of yourself, because the older we get, the more vulnerable. We are all getting old. The older we get, the more vulnerable we are. So, but if we take care of ourselves in this way and that way, we are not going to end up. We are going to end up winning. Yeah.
And now there's a stigma that is associated with COVID-19. People might stigmatize the Chinese people because it started there. People might stigmatize us because we are Africans. They'll say that we are more prone to it. How do we go about this stigma and discrimination?
Okay, so mainly stigma is the negative vibe about a particular, probably, people, and seeing them in a negative light. So, and the problems of stigma, they stem from ignorance. Ignorance, and people tend to have thoughts. People can have very stigmatizing thoughts, and the thoughts, they lead to stigmatizing actions, and they lead also to actions like, actually, what do you call this? Exclusion, and excluding people from different things. So that can happen with this COVID-19. What we need to understand, if we educate ourselves on how it starts, how it goes on, how it ends, we do not need to, and no one asked for this problem. Sure. Yeah, and everybody is prone to it. We may talk about Chinese today, and tomorrow it is everybody else who is dying. So the good thing is, first of all, we educate ourselves. Ignorance is very bad. It's the one that brings about the stigma. We first of all understand what COVID-19 is all about. Then, when we clear up the stigma, it is best that if I am the person who has COVID-19, how am I going to take care? Rather, if today I do not have COVID-19 and tomorrow I am the one who is succumbing to it, how would I want the other people to treat me? So then start from there. Let us treat each other, first of all, how we would like to be treated if we are the ones who have the problem. And definitely understand what COVID-19 is all about, so that we will not be able to, we'll stop stigmatizing the situation, and even discriminating the people who may be affected and their families.
And where does language or choice of words come in? Is it related to discrimination and stigmatization?
Yeah. The kind of words we use can be very stigmatizing. So instead of looking at the COVID-19 people, it is people first who have families. They are farmers, they are teachers, they are doctors, healthcare workers, who, first of all, they are people. So, and then they have been people all along, and then somewhere down the line COVID-19 came in. So let us not look at the situation as a COVID-19 situation. It's people who have to go through a tough time. So the language that we use can actually make the situation worse. So let us not use stigmatizing words and stigmatizing action. Words, they actually start from our thoughts, then they go to the words that we use, then the actions that are going to come together with that. So really, let us understand what it is, and then we will not be able to, we'll stop the stigma.
Okay. So it's basically understanding and also choosing the type of information that you're taking in.
Exactly.
Thank you very much, Judy, for that. Maybe you can just give our audiences your parting shot and your last word, even as COVID-19 and mental health is concerned.
Okay, I would like to say that this is a battle that has actually already been won. Everything starts from the mind. And if you win, we win COVID-19 with our mental health first, we are going to win it even physically. So whatever we need to do, we must do it so that we can be able to, we already know how to win. Just put those words, we just put our actions into it.
In solidarity, we are in this together and we all have a role to play. Let's take care of our mental health. Let's protect our children. Also, let's present information clearly to the elderly and all the special groups. Thank you very much for keeping it Health Nuggets. My name is Saida Munzati. Be safe, stay healthy, and always remember your health matters.